The home health nurse visits the home of a patient who has just been discharged from the hospital after a small bowel resection. Which of the following patient statements concerns the nurse? A. I enjoy eating cornbread with my dinner. B. I drink a lot of apple juice. C. I make my sandwiches with white bread and smoked turkey. D. I limit the amount of milk I drink to 1 glass each day with breakfast. E. I have stopped drinking coffee every day. The answer is A. I enjoy eating cornbread with my dinner. Patients recovering from lower bowel surgery, such as small bowel resection, must adhere to a low residue diet to minimize intestinal activity. A low residue diet includes white breads, cereals, and pastas, well-cooked vegetables without skins, fresh fruits without peels or seeds, tender and well-cooked meats, limited dairy, meat broths and strained soups, and clear juices. The patient must avoid high residue foods, including whole grain breads such as cornbread, strong cheeses and yogurt, raw vegetables, dried fruits or legumes, juices with pulp, coffee or other caffeinated beverages, popcorn, nuts, and seeds. Which of these is a proper lifestyle change to fight gastroesophageal reflux disease, GERD? A. Cessation of soda intake. B. Decreasing fluid intake. C. Eating acidic foods. D. Increasing spicy food intake. E. Eating meals less than 1 hour before bedtime. The answer is A. Cessation of soda intake. Soda intake exacerbates symptoms of GERD. Along with this, individuals should wear loose clothing, exercise regularly, drink plenty of fluids, avoid eating within 1 to 2 hours of bedtime, and avoid spicy and acidic foods. A nurse is counseling a 60-year-old woman who recently found out that she has chronic hepatitis C. She is not sure how she became infected, though she does state that she had a blood transfusion in 1989 due to postpartum hemorrhage. She is concerned about the stigma of the disease and wonders how common it is in the United States. The nurse informs her of which of the following? A. Hepatitis C is the most common chronic blood-borne infection in the U.S. 3.9 million Americans have had or are currently infected with the virus. B. Hepatitis C is the third most common chronic blood-borne infection in the U.S. 2 million Americans have had or are currently infected with the virus. C. Hepatitis C is a rare infection. There are currently approximately 30,000 people in the United States living with this disease. D. Hepatitis C is not particularly common. Approximately 300,000 people in the United States have a current or past infection with the virus. The answer is A. Hepatitis C is the most common chronic blood-borne infection in the U.S. 3.9 million Americans have had or are currently infected with the virus. Hepatitis C is the most common chronic blood-borne infection in the U.S. Approximately 3.9 million Americans have antibodies against the virus. Of those, approximately 70%, 2.7 million, have chronic hepatitis C infections. Most pituitary adenomas are non-functional, incidentalomas. Of the functional adenomas, which are the most common? A. Null cell adenoma. B. Prolactinomas. C. Gonadotrophic adenomas. D. Somatotrophic adenomas. The answer is B. Prolactinomas. Prolactinomas, prolactin secreting, make up 30% of functional pituitary adenomas. The second most common type are somatotrophic, growth hormone secreting, adenomas, which make up 15%, followed by gonadotrophic, gonadotrophin releasing, adenomas, which make up 10% of reported cases. Null cell adenomas are non-functional, they do not secrete hormones. Which of the following are common cardiac signs with hyperthyroidism? A. High cardiac output, tachycardia, and atrial fibrillation. B. Diastolic murmurs and low cardiac output. C. Atrial stenosis and tachycardia. D. Premature ventricular contractions and low cardiac output. The answer is A. High cardiac output, tachycardia, and atrial fibrillation. A cardiac workup on a patient with hyperthyroidism will often reveal high cardiac output, tachycardia, atrial fibrillation, a prominent, fourth heart sound, S4, and full murmurs. This condition is not associated with low cardiac output, and while it may be seen with murmurs, it is not specifically associated with atrial stenosis.